Next from Springfield, Representative Rodney Davis makes a few brief remarks on how the United States should respond to the spread of the Ebola virus at home and abroad. Following the congressman's statements, Dr. Janak Koirala, Division Chief of Infectious Diseases at SIU Healthcare, also discusses combating the virus. This runs about 15 minutes.
Congressman, just to make sure we understand your position, did you say that we should stop flights coming in from Ebola-affected regions?
We should. We should stop those who are traveling with visas from those infected countries in West Africa. And it was brought up to me by an infectious disease specialist here today at this meeting that we ought to look at considering the surrounding countries. Most of those flights are not direct flights. Most flights from the affected areas and surrounding countries would be connected through other areas. So we would have to take a clear look at the visa process, and I think that's something that this administration should consider until we are sure that the CDC and the protocols are put in place at every single medical facility, from a community health center to a clinic to a hospital, that are put in place and they're comfortable that every single nurse is trained and caregiver is trained in what to do.
Of what you heard today, did anything jump out at you, surprise you, or really, what are you going to take away that specifically made an impression from what you heard today?
The fact that the CDC has yet to provide simple answers to simple questions on how to train our nurses and those who care for patients, how to actually remove personal protective gear, what type of personal protective gear is needed in a facility when treating a possible Ebola infection. These are simple questions that should have been answered by the CDC, and in fact that surprised me greatly that they have yet to do so.
You made a passing reference to the funding, and people are alleging, I think the NIH director came out the other day and said we might not have had this breakout if the funding hadn't been cut. Can you readdress again what is the level of funding, and was funding cut for the CDC?
All I can address is what has happened in the last 2 years as I've been a member of Congress, and CDC's funding has gone up over 8%. These are issues that become part of the political debate rather than what should be done when it's putting good policies and good spending decisions in place. The clear fact is, as a member of Congress, to increase CDC funding by 8%. And we can do that by continuing to prioritize. And we also prioritize $88 million just to fight Ebola before we left Washington just a few weeks ago.
Well, it seems that being in Congress is one of the, to some people, experience is bad. Having no experience is the prerequisite. And that said, I mean, you spent a lot of time, a lot about how it works working for Congressman Shimkus. Going from that to being the principal, the congressman, what surprised you in your first term?
Well, what surprised me is that somebody who spent their time here in Illinois working for a member of Congress and understanding how to help constituents break through the bureaucracy of Washington, it put me on a little higher learning curve on the legislative and the regulatory side. But it's a process that I found that if you're willing to go delve into it and you're willing to address some of the major issues that are affecting your constituents, it's easy to make a difference. I was the first freshman to have a bill passed and signed into law. I've got 2 other bills that passed the House of Representatives. One of those is sitting in the Senate waiting for the Senate to take it up. It's a common sense bipartisan change to the Affordable Care Act that helps incentivize small businesses to hire our veterans. We've been effective, and I want to continue to be effective into my next term on addressing issues as important as this. As somebody who is the husband of a cancer survivor, NIH research isn't just about politics, it's personal to me. And I want to make sure that we do everything we can to reprioritize our spending and increase America's investment into research.
Anything happen once you were sworn in and were one of the 435 that did surprise you about what it is like to be a member of Congress versus being on staff but not a member?
Yeah, that there's much more bipartisanship in Washington than what the 24-hour news cycle alleges. There's a lot more congeniality and a lot more working in a bipartisan way to get things done than what is perceived. That is the reality that I saw, and it did surprise me somewhat. And it also surprised me that most people that walk the halls of Congress, they're pretty normal, just like us.
Erica, Harold, Judge Callis, Dr. Gill, care to compare and contrast what it's like to run against those folks?
I don't care to contrast any opponent. I only care to run the type of race that I'm going to be able to be victorious in 19 days and talk about the successes that we've had in our short time in Washington.
That said, the judge did make an appearance in the Blue Room this week and said the Ryan budget is wrong for the U.S., and when I get there, I'm going to vote against it. What is your position on that?
Well, my opponent is successful. She's not going to ever have a chance to vote on a Ryan budget because Paul Ryan is not going to be chairman of the Budget Committee anymore. So that's an easy promise to make because it will never happen for anyone, including me. But the budget itself is a budget that's a vision document. It's a budget that balances, and I think the American people want a budget that's going to balance rather than those that my opponent and Senator Durbin support that never balance and continue to increase spending and increase taxation on hardworking Americans.
Doctor, thanks for joining us on the Illinois Channel. As an expert in infectious diseases, what can you tell us about how concerned should the public be about the potential of Ebola spreading and getting out of the confines to which it's so far been contained?
Well, as we all know, until recently it was a disease that was confined in the West, few countries in West Africa. But with the transportation, the airlines, people are flying in and out. We're always worried about importing the disease in this country. And since the Dallas outbreak, we know that it is not only it has become more of a reality than just a fear. Well, on the other hand, Ebola is not something that is transmitted via air, so it's not something that you have to be worried about just because you are in the same room with another person with Ebola or in the same airplane. It requires that the person's secretions or blood has to contaminate your wound or mucous membrane such as mouth, nose, or eye, things like that before you can catch Ebola. So we have to be careful, we have to be prepared, but I don't think it's a big concern at this point.
How do you imagine the nurses were affected since they were wearing protective gear?
Well, the protective gear can do only so much. After you take off your protective gear, it's important to wash your hands and use antiseptic, hand wash and things like that. And also, when people are taking off the contaminated protective wear, sometimes they have a tendency to touch up the outside of the gown or outside of the gloves by mistake. I've heard that people, just touching eyes while wearing gloves, or when they take out the gloves, they might have contaminated their finger and touched their eyes. So that could be a potential way. So I don't know exactly how it was transmitted, but I heard that it is while taking off the gowns and gloves. And we have an similar example from the SARS outbreak in Canada. Healthcare people who were infected were not using the proper technique when they're taking off their gowns and gloves. So that might be the reason.
What do you think of the proposal that a lot of people were saying we ought to have a restriction and have no more flights coming in from those regions? What is your thoughts on that?
Well, that's a very good question. I mean, in ideal world, probably it shouldn't happen, but in the real world, I guess people have to go even to help them. A lot of people are traveling there, committing to help the people who need help.
Let's just take one at a time. As far as the people coming into the United States, I mean, there's the argument that we could either with military flights or with charter flights bring healthcare people to the affected areas.
Okay.
I'm not trying to put words in your mouth, but
right.
If I'm hearing you, are you saying that we should stop the flights out of the affected areas into the United States, or what?
Well, I mean, it's a good idea, but I don't know if it's realistic just because, how long you are going to do that. And we don't know how long that epidemic is going to last in those countries. So I think it's something to think about, doing a better job with screening rather than stop everybody flying in. So, I mean, that's my opinion, but people can differ.
Okay. Now, what would you say to the people in general about how should we be reacting to this? Well, let me ask you before we do that. Relative to the CDC and how they've been handling this, what are your thoughts on them? Do you think that they have a handle on it? They've been under a lot of criticism. Is that criticism legitimate, or do you think they've been doing an excellent job?
Well, it's a learning curve for everyone because it's a new disease. I guess, it was there since 1970s. We knew about the disease, but only few people were doing research in the area know the disease very well. It was otherwise almost forgotten, by the rest of the, let's say, medical communities, because we thought it was just going to be contained in West Africa like in 70s. So now, since it has come out of Africa and it has caused a bigger epidemic in Africa itself, people are taking more interest. I believe that, CDC has sent out a lot of information to us. We get at least 2 or 3, information packets every week. But is that adequate? I don't think so, because either they're also learning or they don't understand what is the need of the, the frontline people like us, the community physicians and the people who are working on the ground. So yes, deliberately, definitely, I'm not saying that we are not getting any information. We're getting a lot of information. My email gets flooded with information. But at the same time, is that adequate? No, because as we heard today, we still have a lot of questions that probably training, more sessions, online sessions and training, things like that
Some
can
of
clarify
the nurses
questions.
said the information was too vague, that the protocols didn't really spell out all
Correct.
that they actually needed. What
Yeah.
kind of protective suit should we be buying?
Correct.
And let's just say this before we let you go. Our hospitals, from your experience, what would be the impact if just we had even a few Ebola cases? How quickly could those cases overwhelm our healthcare infrastructure, which is not set up to quarantine people or to have 20 healthcare professionals treating one patient 24/7?
So the hospital, I've been meeting with the medical directors of the hospital and trying to coordinate what if a patient shows up in one of our clinics, how to coordinate that. So they are coming up with a plan to contain those patients. Do we have foolproof system? Do we, can we contain it altogether? Are we prepared very well? Probably not quite adequately, but we will try best to contain it, within one particular setting and not try to minimize the number of people who get exposed. But from treatment point of view and other kind of help, we definitely need more help from CDC or from the centers that have expertise in taking care of Ebola patients. Does that answer the question?
Well, that answers part of it. I think I just wonder, in other words, for your normal staffing of nurses and facilities, whether, I don't mean just where we are standing in Springfield, Illinois, but just even at hospitals around the country, it just seems that this is so different of a type of infectious disease that it would require so much more care, given the quarantine, given the nature of the disease, that I, as a layperson, wonder how quickly would we overwhelm our healthcare facilities so that then if something else happens, just your normal influx of patients, you don't have the infrastructure of personnel and maybe just cost to take care of your normal workload then.
Right. So that has two parts. One, taking care of a patient who's already infected or highly suspicious to have Ebola. So a person who actually needs medical care, and that will require a lot of team effort because it requires expertise from not only infectious disease physician but also from intensive care physician, things like that. We do have large number of intensivists and the infectious disease physicians in the community to handle tens of people at the time. But if we have other people who are in contact with them and have, we have to do a screening at a mass level, then probably we need help. But in either case, it's a team effort. If a hospital runs out of the people, then probably they should get help from other hospitals and surrounding places. So I think it is achievable. Of course, we need to coordinate and come up with a plan, and that is the thing where CDC or IDPS can take lead on. To put a plan together, and that's the guidance. I think the other thing that was missing in CDC's guidelines so far.
All right. Well, thank you very much.
Thank you.
Appreciate it.
You're watching the Illinois Channel, an independent nonprofit corporation formed to provide gavel-to-gavel coverage of Illinois state government and other public affairs events taking place across Illinois.